communication, please.
Dear Father, Lord, creator of all things, we come to you this morning, Lord. We just thank you for this beautiful day you've given us. We just thank you for these people that are here today, Lord. Just pray that you'll watch over them, guide and direct them in their lives, Lord. Just be with our people that are healed this morning, Lord. Just pray that your comfort be over them. We just thank you for all the many blessings you've given us, that you've given our nation. Just pray that you continue to bless our people in Jesus' name.
Thank you, Counselor. Next, we have roll call. Please let us know you're here.
Bradley Cobb.
Nominee.
Janelle Fulbright. Here. Bill England.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Harley Bezer. Julia Coates. Joe Crittenden. Jody Fishinghawk. Here. Meredith Fraley. Don Garvin. Tanya Gloria Jordan. Present. Curtis Snell.
Here.
Chris So.
Here.
David Thornton. Kara Cowan Watts.
Honey.
We do have a quorum.
Thank you. Next, we'll seek approval of the June 15th regular session minutes.
Move to be approved.
Second. We have a first and second. All those in favor say aye.
Yeah.
Any opposed? Motion carries. Next, we're to reports from the Claremore Service Unit. George Valera, you are the next contestants.
Good morning.
Morning.
First, I'd like to introduce our new ambulatory director, Delane Alley. She started a couple weeks ago, and she's going to be taking the place of Travis Scott, who's moved on to the Pawnee Service Unit. She'll be taking care of our ambulatory services and working closely with Dr. Mobley and myself.
Anybody have any questions for her? Would you like to say anything? If you do, come to the podium. You are more than welcome. We just got to get you on camera.
My name is Delane Alley. I'm originally from White Oak, Oklahoma, of the Shawnee tribe and Cherokee Nation. So I'm very honored to be working with you, and if you have any questions, feel free to come and see me at the Claremore Hospital.
Thank you. Any questions? Thank you.
My report is in your packet. We're still, outpatient visits are up. In May they went down a little bit, but they're still up for the year. We are, our collections are still above last year's. We're still actively recruiting OB, ER, and internists. I have enlisted the services of a recruiting firm to help that, and we've already, I think we've already scored one ER physician, so that will replace one contract physician. As you probably know, a contract physician costs us about twice what a staff physician would cost, so that'll help there. Our ERA roof project is almost complete. That was $1 million ERA project. We have been approved for a new MRI. We got the CT, a new 64-slice CT machine put in about 6 months ago. It's up and running. We're getting ready to start the cardiology package on that, training for that, so that we can do cardiology imaging. Now I got approval to buy and it's going to be an open MRI instead of a closed. I used myself as an example. I needed something that I could actually fit in, so I bought an open one. And we just put into, we updated our robotics in pharmacy. We had one robot filling prescriptions, which was causing some wait time for the patients who were in the facility, because we only had one machine filling scripts. They were queued up behind all the refills, and they just waited their turn in line. That was causing a backup and wait time for patients. So with the new robotics, we upgraded and bought the biggest capacity machine Parada had, and we bought two of them, one just for patients that were there in the facility. The other one is for refills and the mail order that will start, hopefully in the next 6 months. That way, hopefully we can alleviate a lot of wait time once the script gets entered in the computer. it'll come up in pharmacy, and once they come over and check in pharmacy, they shouldn't, the goal is they shouldn't have to wait but just a few minutes to get their refill. So that's a goal of ours. Those are in. One is up and completely running. They're working on getting the other one integrated into the system. So those are already up and running. Other than that, contract health is still...
Contract health?
It's contract health. It's tight. I think I've got a couple of inquiries. I think I've gotten back with everybody on those.
Councilor Baker?
Yeah, and contract health, when you collect insurance, where does that money go? Does it go to the hospital, or do you plow it into contract health?
When we collect
Third party.
third party, it goes back into the running of the hospital.
Okay, so none of it goes to contract health.
No, we run the contract health off of specific line item contract health funds,
Okay.
which for Claremore is roughly $10 million. It sounds, and I'll even break it down a little further for you. It sounds like a lot. You break it down to a weekly spending allowance, it's about $190,000 a week.
Yeah.
And if you look on your report, and in the past reports, we're gaining 500 to 1,000 new patients every month, which means our referrals are going, the number of referrals and cases are going through the roof, which means we're having more denials because we're not getting any more funding. That 190 is static, and we're looking at ways. There are Category 1 life-threatening situations that aren't getting funded because we don't have money. We're trying to figure out a way to do that, but we're doing the best we can with that. So I have a new priority system in front of the governing board in Oklahoma City right now, trying to get them to sit down with me and approve it so that we can use that. And when I get that, I'll bring it to you and show you what our priorities are going to be. An estimate is if we paid all the Category 1 life-threatening cases that came through, it would take us about $500,000 a week.
Any other questions? Thanks.
Thank you.
Appreciate it, George.
Huh?
Cherokee National Health Services, Melissa Guerra's out of town. Dr. Graham is the next contestant.
Yes. Good morning. Everybody has their packet and hopefully has had the opportunity to read through it. A couple of things I wanted to just highlight. We do have a new clinic administrator at Stillwell named Christy Henshaw. She started last week. Harris, I'm sorry. Thank you.
Dr. Graham?
Yes?
I've already got 3, so I'm going to go ahead and let them ask some questions, if that's all right.
Sure.
Did we take him a third-party pay into contract health?
We usually don't directly, but we haven't had to. We've had enough that we've been able to manage it. And I think one of the big differences that we have that Claremore doesn't have is that so many of our patients have a third-party resource. I think George told me only 13% of his patients have a third-party resource. A lot of our patients, over half of our patients have a third-party resource. So that really offsets our expenses. So we haven't really had to shift any money over there to be able to keep that.
He's having to take every dime of it just to stay afloat, and we have options. With the third party.
Yeah.
Okay. But I thought we had taken some third party.
And we may have at some point, though.
Generally, this council has money, we, throw in some of the third party, to contract health.
Yeah, and when we may have, I just can't recall.
Okay.
Councilor Fulbright.
Yes, thank you. I have a couple of comments here of some experiences at Hastings at the emergency room.
Okay.
My brother took his wife over there and she had a broken leg, and they saw Dr. Franklin, and they just got right in. Everything was just perfect. And they'd used him before, and they referred her out to Hillcrest for her surgery. And they said there's no problem whatsoever. Well, my cousin from Muskogee calls me. She goes over there at the wrong time with a spider bite. Right at the time they closed down Fast Track at 10 o'clock at night. And she said, this place is crazy. I want you to know that they're just standing everywhere. And I said, well, honey, probably about half of them need to go home, you know. And she sat there all night till 6 a.m. the next morning waiting to be seen for a spider bite. She said everybody was so sick, I'm sure, but is there just times when the place is just flooded absolutely?
We actually have somebody that's a couple people that are really smart over there, and they've done these. I don't even know what they've done. All these charts where they've mapped out the peak hours of when there's kind of the flood in the ER. And you're right, it's when the Fast Track closes. And so what they're going to do is we're going to change the hours of Fast Track and extend it to midnight.
Oh, okay.
Because then if you look at like the hours that people come in, if you extend that to midnight, most people stop coming in about 9 or 10. And if you go to midnight, you should catch up on all those people so they don't have to close down and ship them to the ER to be seen.
Well, I tried to explain to her, and she said, oh, that Fast Track doctor was so wonderful. He came on down there and started seeing people. He worked overtime. And she just said, oh, I want you to know it was just awful. And I said, well, that's not most people's experience. I had a lot of people go there, and they got some of the best doctors.
And we've looked, like at leave without being seen, and that's the time it happens, is that time. It's like from about 9 to 2
I told
in
her
the
she
morning.
picked the worst possible time to come. So. But I was going to make a comment about Sallisaw. Everything seems to be going great down there with the pharmacy improvements, and
Good.
everybody's being patient, and
Good.
everything's going great down there.
Good.
So,
Good to hear that.
That's my only comment.
That's for Callum Watts.
Thank you. Okay, so Claremore Indian Hospital signage. What can you, the health department, do to assist us in making sure? Because I see there's a lot of efforts being poured into Hastings, even though we've compacted it, and yes, it's our facility. Claremore Indian Hospital, our folks should not be secondhand citizens.
We probably need to talk to Angie Drews. They were responsible for doing all of our signage. They control the signage. They pick it out, order it, and it has to meet all the branding guidelines. So we could probably talk with Angie Drews about, is there a way that we can get some signage? Because, we have, Cherokee Nation has programs there too, so.
I would appreciate that being put on the priority list, and if you keep us updated in this monthly meeting until that's completed or coming to some solution.
Okay.
I have 2 more questions. So behavioral health for Cherokee Nation at Claremore Indian Hospital, we continue to have issues there. What can be done to resolve staffing issues and responsiveness on the phone and consistency on the phone?
Well, I think what can be done is that's a management issue that needs to be dealt with through a management channel.
I'd appreciate an update, even since it's personnel, I guess, offline. But I'm not saying it's one person or all of them, but from a service perspective, the feedback I get is somewhat alarming.
Yeah. Okay.
The other thing is, so is the signage and behavioral health. Where are we at on compacting for the contract health services?
We have still got that, looking at it, waiting for some more stuff from area office.
Is there anything that I can do, or the other council people that are affected, their constituents, in getting a response from IHS? Do we need to escalate that to our Congress people and our senators, or what's the deal?
Let's have some more discussion about that, probably in a smaller group, and talk about that. There are other issues that, when you're looking at compacting contract health, that we need to talk about, as far as making sure, and George has some really good ideas about adding staff there for the direct services, but we got to make sure the direct services component is there to support contract health, so everything's just not shipped to contract health.
Okay, and I apologize, I do have one more. The jurisdictional issue at Claremore Indian Hospital. I have folks that are ready to retire, but they're waiting on, including the chief of police for the city of Claremore. We where are we at? What do we need to do? I mean, we're willing to take a contingency to DC if we have to. How do we get these folks' attentions, and how do we get Senator Coburn off his desk?
George?
He's a federal employee, he probably can't.
We've tried for 10 years, so.
Yeah, it is an issue that we're working on the federal level in coordination with Claremore Indian Hospital, IHS Central Office. It's something that we're working. It's just something that takes time. Looking for that opportune moment.
And
to
it's been
attach.
10 years probably since
Yeah,
we've worked
it's
on
been
it.
10 years. We're looking at every angle. We continue working the issue. I mean, it's not something we've set aside, not something we put on the back burner. We do to continue to work it each and every
And I
day.
know, because I've worked directly with both of you on this issue and George. I guess a bit of frustration that if it was here in Tahlequah, it'd probably already be resolved somehow. And maybe that's because of different leadership in the other venue partners we have to deal with. It just gets frustrating. And I'm the youngin' in the group on the whole thing. I'm the one with the least amount of time put in on this issue, but it continues
To be an issue.
I mean, he told me about another issue that came up, and he could not enforce anything to remove folks that were creating problems for other patients and the staff being at risk.
And I understand that, but I disagree about location. I mean, we definitely have support on the House side. Senate side, they have some other concerns and they think there's a better or a different avenue to address it, possibly an agreement with the hospital and Cherokee Nation, etc. There are many ways that Dr. Coburn would like to address it other than a legislative act.
Well, I have a group of Claremore Republicans who are not even Indian at this point that would like to go to the table to help resolve it. So whatever we need to do, if we need to rethink this, I would like some time set aside to address this issue.
Okay.
Sure.
Thank you. Thank you.
Councilor Garvin.
Yes, just to follow up on what Janelle was talking about. I got that same call late that night, and her suggestion was, when I get some more money to add on to the emergency room in Hastings, and I'll go right and report it in. Money's kind of tight right now, but is it kind of small? I don't.
It is small, and one of the things though that we are going to do is expand the ER there and expand the urgent care. So when you come in to the ER right now, we're going to actually make that where the current ER is going to be more of a waiting area, and there's going to be a pharmacy. So if you go to the urgent care, you can just go right there and grab your medicine and go. And then we're going to have a bigger ER that's going to it'll be about twice as big, and an urgent care facility.
When
It'll be
will all
all.
this take place?
We are working right now with the architect, and we should have everything finalized. I looked at the drawings, it's been about 2 weeks ago, and they hope to be ready to start groundbreaking like very soon, because actually the projected date of completion was next July.
That sounds good. Another observation, the Three Rivers Clinic over in Muskogee, some of the driveways getting kind of soft. I don't know. Would that still be under warranty, or we'll just have to do it on our own?
I hate to guess, but I mean, as you guys are aware, we've had driveway issues and we had some issues at Salisaw with driveways, and we've not had good luck with driveways. But I can check, and I know that George Long is aware of it because we've had a discussion about it. And
It's more parking than driveway.
yeah, and for some reason I think it's not under warranty. I think we're going to have to go in and fix it.
Chisel that. Thank you, Mr. Chairman.
Councilor Baker.
Yeah, 2 or 3 things. First, the Hastings must just be perfect, because last week they delivered the most gorgeous little boy that God ever created, and it was a wonderful experience. He came out with a full head of hair, and anyway, it was mother, father, grandparents, everybody was just tickled pink. The second thing, apparently we're moving some program type stuff out for offices. And a treadmill was mentioned that they were moving it out to make room for offices, and it's really going to kind of hamper it. And I'm thinking it was the stress test area, but it might be the rehab.
No, I think you're right. I think it's because they have 2 areas where they do stress testing and EKGs and EEGs, and they're going to move it all to one area now. So it's going to be in just a single place instead of I think one was on the first floor, one was on the third. I think they're moving it to a single area so it's all together.
Okay, well, apparently they're going from a bigger room to a small room, and they're not real comfortable, but it's all going to work out good.
Okay.
So anyway, and if they know something different's coming and it's going to be better and yada, 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 that would probably be something really good. And this might be for after this meeting, but, you know, I had a lady who we sent down to the city, or sent her husband, and he died, and then she started getting bills for it. And we tried to work on it, and she's gotten a letter from us saying we paid the hospital, and she was paying $10 a month, so we sent her a check for $200 or something, because we've been trying to get this taken care of for 2 years. And then she got another bill today. And so.
From City Hospital? Yeah, just give it to me afterwards.
Okay. And but anyway, I was up at the hospital quite a bit, and morale seems to be excellent.
Good.
And
Good.
and clean.
Good. Thank you.
Councilor Fishing Hawk.
I was just going to tell you, I had stay at Hastings for a couple of days, and I thought it was really a great stay of Georgia.
Good. Glad.
Councilor Soap.
I'm just a little curious, Dr. Green, what is the standard treatment for a spider bite?
Depends on what kind it is. You know, if it's a brown recluse, or a lot of times you can have to put people on antibiotics. Sometimes you give them a little bit of steroids. If it gets really big and necrotic, then you sometimes have to cut out that area.
Okay. I was curious, so thank you.
Councilor Buzzard.
Lori, just a couple of questions. Last year, I think about this time, we've always talked about a new clinic in Jay, and I think we're going to have the oldest clinic within the Cherokee Nation health facilities now. And we talked about, maybe looking at a new hospital in Tulsa. I'm wondering where that is. Are we going to submit again for the hospital, or are we going to submit for the Jay clinic, or a clinic in Jay?
We haven't made a decision about that joint venture yet, about what we're going to submit. We will, as it gets closer to time.
Well, the reason I bring it up, I want to bring it up, and I'll bring it up every 6 months or every year, is to remind people that we need a new clinic up there. It's just not large enough.
I agree.
It's an old building. It's probably 50 years old. And, we feel like that was one of the first clinics within the Cherokee Nation. And now we've got 4 or 5 others that have been built. We're still waiting on a new building. We've never had a new building there. The other thing, I've had probably 5 calls about the walk-in clinic at Jay, and I wish you were director there. You have a director there at Jay. People tell me that they can go in there and they have to stand sometimes 10 and 15 deep in line to get in. And I said, well, why are you doing that? And they said, well, because we only have one receptionist there taking the intake. And well, I said, well, what the receptionist doing? And what I understand, the receptionist has to update the chart and do all that. And then if you got a new person in there, then when we got one there, then you're going to be standing there for 20 minutes trying to get this new chart made, or however they're doing it. But I wish you'd check into that and see if we couldn't maybe put 2 up there, or whatever. So, especially during the peak time. But I've had probably 5 people that call me about it. And I forgot to ask about it last month. I thought, well, since I heard people asking questions.
Okay. Because when the peak hours are, first thing in the morning, first thing in the afternoon.
You shouldn't have a problem. Just put 2 people up there.
Put 2 people at the window.
I appreciate you checking for us.
One more thing on Jay, when we're talking about that. We hired a full-time pediatrician that's going to she's going to be starting at the beginning of August. So we're really excited about that. She's a Cherokee, and
Yeah.
so.
And just to follow, I have one more follow-up, we talked about this before, Dr. Grimm, but another request that I see a lot, but as a podiatrist, and I understand we have on-staff podiatrists at other clinics, and I just wish we could have it on a rotating basis, maybe go there once a week or once every 2 weeks and schedule those people in, because what I'm hearing is they send us out through contract health when we have to go to Bartlesville or we have to go to Tulsa to see it, and then the next thing I hear, we don't have gas money. So even if we just had one up there, one day a week or one day every 2 weeks and get those scheduled in, we could certainly help a lot of our patients. So
Yeah.
please take that into consideration.
We will, and it's funny you should say that. Our head podiatrist, I just did his evaluation, and part of his action plan is to develop a plan to provide podiatry at all facilities. So we've got that on the list to do.
Okay, thank you, Mr. Chair.
Councilor Fishing Lot.
Oh, I am getting quite a bit of complaints on not having a walk-in doctor down at UNP.
Okay.
Sometimes it seems like they're calling me 2 or 3 times a week saying we don't have a drop-in doctor.
Okay.
Could you check on that for me
Yeah.
and see how often it is?
Okay.
Thank you.
Still have your report, whatever you want to do.
I think that's all I have.
Any more questions for Dr. Grimm? Thank you.
Thanks.
For the old business, there appears to be none. New business, there appears to be none. Any announcements? We have one from Councilor Baker from Oklahoma City.
PAC subcommittee meets immediately after this.
And the next scheduled meeting for the Health Committee is Tuesday, August 17th at 11 a.m. I'll ask for an adjournment motion.
So moved.
Second.
We have the first and second. All those in favor say aye.
Aye.
Any opposed? We are adjourned.